All right, thank you everyone, and thank you to SAGES for the opportunity to present my work. I'm going to be presenting our paper entitled Long-Term Abdominal Complaints Following Bariatric Surgery. This one going? That's sorry.
Yeah, there are two buttons here. It's confusing. You can use that.
Thank you. All right, there we go. I have nothing to disclose. I think, as we all know and has been brought up several times already in this session, the prevalence of obesity as a disease is increasing nationwide as well as worldwide. And therefore, bariatric surgery has paralleled this increase, as it is the most effective treatment for the disease of obesity. But abdominal and GI complaints have been reported to increase after bariatric surgical procedures. But conversely, weight loss may actually improve these abdominal complaints. So few studies have really looked at preoperative versus postoperative GI symptoms in bariatric surgical patients. Therefore, in our study, we used a large, near-complete observational cohort to examine long-term abdominal complaints in patients who underwent gastric bypass, adjustable gastric banding, or sleeve gastrectomy. So we utilized the longitudinal assessment of bariatric surgery, or the LABS-2 database, with which many of you are probably familiar with. It's a multi-center, prospective, observational study that's been previously well described. We included from this database patients greater than 18 years old undergoing either a gastric bypass, a sleeve gastrectomy, or gastric banding. We excluded patients if they didn't get one of those three major operations. They had some type of revisional operation initially, or they didn't have their preoperative or postoperative survey. Multiple metrics are obtained preoperatively, and then we follow them yearly for up to 7 years. All right, so how did we actually assess these abdominal complaints? We used the GSRS survey, or the Gastrointestinal Symptom Rating Scale. This includes multiple domains in many areas. It includes abdominal pain, diarrhea, constipation, reflux, and indigestion. Patients were asked multiple questions within these different symptom domains, specifically if they had been bothered by the symptom within a week. You can see some of our example questions up there. For reflux, for example, we asked, have you been bothered by acid reflux during the past week? There's multiple different questions that come at each domain in a different way to try to get a little bit more information. Each of these questions were graded on a 7-point Likert scale, starting at no discomfort with a score of 1, and ranged up to very severe discomfort, a score of 7. So we ended up with a total of 2,458 patients were enrolled in LABS-2. We had to exclude 414 of them from the analysis, either due to lack of GSRS survey data or they had a different operation other than the three I mentioned. That left a study population of over 2,000 patients. The majority were gastric bypass, with a minority being sleeve gastrectomy. So when you added up all their GSRS scores from all the domains, you could actually see a drop, when meaning an improvement of symptoms from 1 year after surgery. So it went from 26 to 24. This is similar to our bypass and our band patients. The scores pretty much remained stable after that, though. So now let's look at the difference from the mean GSRS score, meaning how much did it drop, and did that drop change over time? And again, we didn't really see much. The GSRS score remained stable over time, meaning after the initial drop, there's really no difference from the baseline score. Although composite scores didn't really change a whole lot, I think the real meat and potatoes of this paper is what happens within each domain. So let's start looking at gastric bypass initially. For gastric bypass, abdominal pain or discomfort decreases at the 12-month, 36-month, and 48-month time points, with the expected significant improvement in gastric reflux at all time points. Interestingly, though, indigestion did increase at all time points after operation. So let's look at our gastric band patients. I thought this was really interesting. They got more constipated over time, but diarrhea did increase. Initially, there was a decrease in reflux, but that did not persist over time. Finally, let's look at our sleeve patients. They did have constipation and reflux symptoms that did increase over time, although only constipation really reached the statistical significance. I want to advise caution in interpreting these. We had a low number of sleeve gastrectomy patients, and therefore this is likely underpowered. I thought this was really interesting looking at our patients who lost weight, because the big question is, does weight loss really help? And we found that it did. So weight loss was associated with an overall improvement in your GSRS composite score for gastric bypass and our band patients, with 27% of patients experiencing improvement in their symptoms. For every 5% of weight increase in weight loss from baseline, bypass patients were 25% more likely to see an improvement in their GSRS symptoms. For band patients, it was 22% more likely. There was an association for sleeve gastrectomy patients as well, but this didn't reach statistical significance. Again, it's likely underpowered. So this study does have some limitations. First off, gastric banding is not as widely performed, at least in the United States, as it used to be. It's been mostly replaced by sleeve gastrectomy. We had a pretty small number of sleeve gastrectomy patients in this study, so it's difficult to generalize data for those patients. However, the study does represent a large, near-complete cohort of patients with long-term follow-up after bariatric surgery reporting on their gastrointestinal symptoms. So let's return to our original question. Do abdominal complaints increase after bariatric surgery? No. Actually, we found that GI symptoms don't worsen after bariatric surgery. There's actually a small improvement with 1 year after surgery and an increased likelihood of improvement with every 5% of weight lost. So I'd like to thank my collaborators. I want to thank the lab's authors, and I really want to thank SAGES for the opportunity to present our work.